Hello everyone. Hello, Bill, and thank you very much for the introduction. So, we don't have a lot of time, and I could be talking about the topic at hand for hours because it is so essential and so important. Yet innovation is something that can take many shapes and forms. So I'm going to take a standpoint from the health perspective. I am a sports medicine doctor, and sports comes first, but actually medicine should be first and always should be first. So health is at the forefront of the discussion here. And we'll see how, obviously, today's topic with the development goals really brings all that together. So let me bring you a few points on how we approach physical activity and health. And if we can move to the next slide, please. So this is how I'd like to approach it: the good, the bad, and the ugly. Now, you may remember the movie. It's also a tribute to Ennio Morricone, who passed away not too long ago. But let's move forward and see what I mean by this. Next one, please. So the good is physical activity and health-related outcomes. So on this slide, you have a few pictures that show you a little bit what physical activity means for health. At the top left, of course, you have cardiovascular health and everything that has to do with mortality, early morbidity, people suffering from diseases. And if they stay active, if they have a higher fitness level, they will have less early morbidity, so disease, especially cardiovascular disease. So staying fit for a long time could lead you to be like Mr. Marchand, who's riding his bike after 100 years old on the second picture. But it's also important for your daily activity as a professional to be ready to meet the challenges of today's world. There's always a lot of pressure. There's always new challenges that come your way. And being fitter helps you cope with them. But it also means that if you're fitter, you're taking the time to be fit. So you're using also time to recover and to benefit from whatever activity you're doing. And we know also that your cognitive activity or ability will benefit from regular physical activity. Of course, extremely important for kids. And we know it especially at a time like this, where in Geneva, for example, the State Council has just ordered sports teams and clubs to stop the activities for kids, and this is a problem. Also, people who are seniors who may be suffering from limitation of movement may use aids, like that second picture at the bottom left. Staying fitter helps you to do your daily activities. And ultimately, at the bottom right is healthcare costs. So a fitter population that benefits more from physical activity has less diseases, cost less to society. So all of these elements flow into what's good. So how can we help people be more active? Let's say using technology. There's many things out there, but let's see, next slide, please. What's not very new, actually. This is the pedometer, and it's already been there from the 60s in Japan. So, but what we know is that this simple device that everybody has now, so you have it in your smartphone, you can have it in your smartwatch, and it just measures how many steps you take. And they're fairly accurate if you wear them all the time. And we know that if somebody does more steps than they used to, if you increase your number of steps per day on a regular basis, you will increase your fitness and you will improve your health. Very simple way to use technology. Nothing fancy there. You all have it, but yet there's so many people who don't use it and who don't even know what to do with it. So that's one aspect of technology that could be used better. And we know that if we tell someone how to use it, basically where to look for the numbers, they might increase their daily count by 1,000 to 3,000 steps. And if the aim is to go anywhere from 7,000 to 10,000 steps a day, you already done a good job by increasing that much. So let's move to the next slide and show a case study. This is the typical problem that we see. Let's say a 56-year-old gentleman who stopped exercising in the 90s, who's put on 30 kilograms. He's lost, he's put it back on, done a lot of cycling of his weight through different diets, and we know there's so many diets out there. And he's got arthritis, he's got hypertension, and he's got obesity. So he's basically a ticking bomb. And he's also been told that exercise is bad for his hips, so he should avoid exercising. So not a good starting situation. Now let's see what we can do on the next slide. The traditional approach, which may be not innovative, but which is what we should be doing a lot more, and we're not doing enough of that, is to give good counsel on what type of exercise they can do. Use a wearable device. It may be a pedometer. It may be something that tracks GPS movement as well. And setting goals for steps, for example. These patients had also dieting counseling by some of our advisors that are pictured here. And then also was considering buying an e-bike to go to work. So basically that's it, very simple advice. But it was teamwork at play, and on the next slide you can see the result. Now obviously this person was motivated and wanted to introduce a lifestyle change. But over the course of 2 years, there's 14 kilos lost, which is 12% body mass. It was gradual with a bit of tapering along the end. But for 2 years, it's a very good result. And we know that the cardiovascular risk of that person has diminished. Health has dramatically improved, not to say mood and wellness in general. So please move to the next slide. And one advice was just to take the bike to go to work. So we would simply map the road to work and say, okay, this is doable. You know, if you get your e-bike, you could do this. It's 7.5K each day. Out and back, it's 15K. You're going to get a little bit of exercise. Next slide. Tracking walking through the wearable. We could counsel the person from a distance using the device and simply log in onto the platform and see how many steps per day that person was doing, and it kept increasing to get to 10,000 steps per day on average. So next slide. This is an example of how you could use it and somebody just accepts the device and the uses. But the problem with these tools is if you just hand a device like that to someone, it won't necessarily be sufficient. So next slide. We know this from any kind of novelty. You get tired of it. There's that novelty effect, and this is a study that looked at how much people use the device during a study where they had an incentive period, so they would be helped and counseled, and then after a few months they would stop using it. So one possibility is that they stopped using it because they felt confident doing without the device, which is the optimistic view, and that would be great. And actually technology could be just a tool, transient tool, and that would be great. Next slide. Another problem with technology, or let's say social media and exercise platforms, let's say like Strava, is that basically what people are doing is they're trying to beat themselves every time. You're trying to become the king of your track every time, or your mountain, your own personal mountain. So every time you go, you need to do better. And that's not how training works. And I've seen quite a few people that have started exercising and used devices like that or logging what they do, and they need to get medals every time, and they get tired and they get injured and it doesn't work. So comparison and faster is better, and rankings are not the way to sustainable physical activity for health. So 2 clicks, please. Next one, yeah. So there's also a lot of apps out there. and they promise you in 7 minutes you can get fit. So you can do all of these interval trainings, HIIT sessions, there'll be burners, cardio, burpees, and whatnot. And here's one that's pretty popular, and it promises you that you can actually get some results you don't have a minute wasted, or you'll compete with friends, etc. Now, please click. And out of those 6 elements, I'd say, well, creating a habit is a good thing. Having customized workout is a good thing, but all of the others are not really sustainable. Yeah, motivation can be pushed a little bit, but they're not the best ones. Click, please. Other apps promise you these types of things, okay? The typical before and after picture. And next click, we end up seeing people posting these things, and that's supposed to motivate and incentivize people. Now, I'm not really sure, and the message is not the correct one, because this is not enabling people to be physically active for their health, and it can be very much counterproductive and promoting images of something that's not necessarily extremely healthy or that's not attainable for some people. Next slide. So what we've done during the pandemic at Latour is we've developed an e-coaching program, basically trying to get people within their homes and possibly having them order a little bit of equipment, but very minimal equipment, and give them a program of things that's doable and that's going to get them moving, activate their muscles, introduce their break, some movement into their breaks from their home office place. And we've had pretty good success with that. And I think in times of pandemic, this definitely needs to continue. And we're facing probably other lockdown periods, and we need to continue on that way. Next, please. And sometimes it gets ugly. You know, people use devices, and when they don't function, like Garmin that was hacked in July, people get very angry. It's like they can't do without their device. And then you're thinking, okay, am I doing exercise to post it somewhere, or am I doing exercise to stay fit? So then the motivation might become a problem. Next slide. Taking it to further extremes, maybe you've watched The Social Dilemma, which is a popular documentary at the time, or you've watched an episode of Black Mirror that looks at what social media can do to society. Well, social media in sports can be a problem as well, and on some of the aspects that we already discussed. But when people start isolating and using platforms and devices for something that's not pushing their own personal health or their collective health, then it's a problem. Next slide. So what do we do now? And we have this pandemic, so we can move on to the next one, please. First, important to recognize the starting point and the guidelines that are out there. Now, WHO has been working for years on the global activity plan for physical activity. And that's the document in the middle here. Very good document that they've published a year and a half ago. And it talks about how to create active societies, active places, and active environments. And this is very good for cities to look at models and frameworks that you can apply to every project. Next slide. With regards to sporting organizations, obviously, we need to move beyond traditional approaches. So the club that has training sessions for their members, but then not for other people. And if they shut down, and if like during a pandemic, the activities are being shut down, then nothing else happens. We've all experienced it in the last few months, where maybe our kids and I've experienced that, you know, are members of some clubs, and then all of a sudden nothing else happens. So we need to move to other ways of promoting exercise through sporting associations, but that move beyond the setting in which they usually operate. So that's adaptability. new context requires some evolution, and we need to consider the wants of the peoples in today's day and age and environment. Digital technology is a tool, and we need to be using it, but the purpose needs to be clear. Mr. Bach mentions, mental health is part of it, and socialization definitely an important component. And in times of lockdown, it's very hard to look at socialization because we're socially distancing. But there's other ways of socializing, and without the ugly components of social networks. It's important to move beyond sports per se and involve communities and families and companies. Now, I would suggest also sporting organizations need to partner with the other actors, and that's the health sector, the education sector, and of course it is happening in many settings, but we can do more of it. Next slide. So obviously, we need to understand users and what they want, what they can do legally now, so what they're doing regularly, how they're doing it, and how we can improve it. This is the human-centered design, and there's approaches to look at that, and I think these methods should be definitely applied. And again, Thomas Bach pointed to the human-centered component, and this is extremely important. So next slide. I like to consider projects and any complex problem that you have under the lens of a design thinking approach. There's the human, there's technology, and there's the business side of it, and in the middle lies innovation. What is a healthy city to you? What is a healthy sporting organization that promotes health and physical activity for the citizens, but also for the economic partners? And we've seen on the slide before that it was, what can people do? How are they doing it? But ultimately, it's the why we are trying to do things. And I think their sporting organizations need to put a strong focus on health, on sustainable health, on bringing people together and moving beyond the usual sports. Next slide, please. One way cities have been doing that is through the Global Active City project and labeling. I'm sure you're familiar with it. If you're not, you should look it up because it's a fantastic project supported by the IOC. Of course, it means using the spaces out there according to the WHO program and global activity plan. Now that's not necessarily possible in times of pandemic, although there's not strict lockdowns everywhere, and the places and spaces can be used to promote physical activity. Next slide, please. Now, with that being said, I'll conclude here that little overview of how I approach health, and obviously this is a very quick summary of a few points. We're far from this depiction of a city where there's a strong community and people are being active and they're playing together outside. And obviously we have to reflect on that when we are facing times of pandemics. We need to look at new approaches so that people can still be together, participate together, work on their physical conditioning and their mental health, but maybe without the usual component of physical contact in the next few months. Thank you.